Symptoms like vomiting and diarrhea can often mean an upset stomach. But what if it was something more fatal? Approximately 59.8 million homes in the United States have a canine as a pet. That means about 45.5% of the United States have made the conscious decision to adopt a canine. I have been working with emergent cases for the last 8 years as an emergency veterinary technician. During that, I have personally seen how devastating parvovirus can be to a canine. Often with even the most life-saving measures, it can be unsuccessful. To bring more awareness about parvovirus, I would like to talk about what it is, how it affects the body, and how it can be prevented. What is canine parvovirus, and how does it affect the body? Canine parvovirus is an infectious disease that started spreading worldwide in 1978. Canines were presenting with symptoms such as vomiting, diarrhea, lethargy, and inappetence. The symptoms came on very rapidly and were very severe. Parvovirus has an incubation period from 3 to 7 days before the dog would even present showing symptoms. Parvovirus is most oftenly diagnosed in animals that are 6 weeks to 4 months of age, and it can also cause severe disease processes such as gastroenteritis and myocarditis. The parvovirus infection is very serious and can be life-threatening if the right steps are not taken. The best way to protect your pet from getting parvovirus is setting them up for success and starting off with some early preventions. Parvovirus is transmitted through infected feces and can be contracted through oral contact with contaminated surfaces. This makes it extremely contagious because it can be contracted through shoes, clothing, or practically any surfaces. Some of the most common places that you can contract parvovirus are going to be highly pet populated areas such as dog shelters, dog parks, pet stores, animal shelters, and even boarding facilities. Even though parvovirus is highly contagious, there are steps you can take to prevent it. The most important step is to properly vaccinate your pet. There is a vaccine called DAP, which stands for distemper, adrenovirus, parvovirus, parainfluenza, that can be given to your pet at the beginning stages of 6 weeks of age. It would be boosted every 3 to 4 week intervals until the canine is approximately 16 to 20 weeks of age. At this time, your pet would be considered fully vaccinated. An important tip to vaccines is always consulting with a licensed veterinarian so that you can properly stay on a booster vaccinating schedule to the proper age. Sometimes even after all the steps you take preventing parvovirus, there is still a risk that your pet can get parvovirus. Parvo itself does not have a cure, but can be treated symptomatically. If caught early, there is a monoclonal antibody injection that can be given to lessen the symptom severity. Most common diagnostic tool to diagnose parvo is called ELISA snap test. This is commonly used in veterinary offices due to its efficiency and rapid diagnostic, which can be read within 10 minutes. Typically, by the time the canine is being diagnosed with parvovirus, there needs to be medical interventions made. Most common medical interventions are going to be hospitalization with intravenous fluids to help with losses from vomiting and diarrhea, anti-nausea injections, antibiotics to prevent secondary infections, a nasogastric tube so we can supplement nutrition, and even in some severe cases, blood and plasma transfusions. Getting a puppy can be very exciting, but prior to adopting a puppy, make sure you do your research and have a plan in place. Parvovirus is very easily prevented, so talk to your local veterinarian prior to adopting a pet to make sure you're well educated and when your puppy will need to be vaccinated. Parvovirus is a problem that is not commonly talked about. It is something that every pet owner should know about and know what it is, how to prevent it, and what to do if symptoms are presenting. When adopting a puppy, you need to make sure you're making responsible decisions. Do not think that parvovirus that won't happen to your pet, that you won't take them to the places that the parvovirus is. It is a very serious and deadly virus, and I have seen too many animals lose their lives to such a preventable disease.